is hosting the 38th Annual Pharmaceutical Society of Kenya Symposium. The symposium was opened by Chief Administrative Secretary in the Ministry of Health, Dr. Rashid Aman, who affirmed that the government is keen to pursuing the 4 key priority agendas for the next 5 years, among them universal health coverage and pharmaceutical manufacturing. Dr. Rashid stressed that stringent regulatory framework should be put in place towards achieving a vibrant pharmaceutical industry that produces medical products that are of high quality. And now joining us from Mombasa is Francis Mtalaki. Francis, good afternoon. Of course, they've talked about regulatories. Have they proposed any?
Well, good afternoon, Ashley Mazuri, and from Mombasa, as we have put it, that it is day 2 of Kenya Pharmaceutical Association. This is a 2-day conference that has been organized by the association, trying to dissect many issues revolving the health sector and specifically the pharmacists that we have in this country. And some of the participants, I do have them here, which is Honorable Sabina Chege from the Parliamentary Committee to the Ministry of Health, basically, and I want to bring her so that we can be able to dissect some of the issues that have been able to discuss. Maybe we can begin by telling us some of the talking points that we've been able to discuss.
Basically, my invitation today was to come and talk about UHC. UHC, universal health coverage, is part of the big 4, the agenda of the government. And now with everybody coming on board, we have the handshake and everybody else. That is mainly our focus. And also to update the team on where we are on the health laws. We have some amendments that have come up. They also had their own, they did the public participation. They came and did their presentation just to appraise ourselves and ask ourselves where we are, because with the enactment of the new health law that was enacted late 2017, several other acts had to be amended so that they can be able to be in conformity with the new law. And so the team brought some amendments in our committee. Part of their concern is that they need more membership at the Pharmacy and Poisons Board, where currently they only have 1 person in the membership and the rest, 6 of them are pharmacists. And with the Director of Medical Services, a person in the veterinary services, that means then they are underrepresented and they really need their issues. Of course, for us to achieve UHC, we have to look at the personnel, where the farm techs are not, there are many trained, around 10,000. Only 400 are employed in Kenya by the government. And so there's a call for inclusion. There's a call that even at the lowest level, we have medicines being prescribed at a dispensary, and currently we have nurses and also clinical officers are the ones who are doing the prescription, but dispensing, they also do the same because they don't have farm techs at that level. And so we are saying for us to achieve UHC, you must make sure that we get it right. From how we even prescribe our drugs and how the interpretation is done, how the patients are explained to how they use the drugs. There should be some clear consideration and somebody who has such training. So for us is to look at the government, how we can be able to partner with the county government so that we make sure that at the lowest level, even at the dispensary level, we have at least a farm tech, a clinic officer and a nurse. That means then we will be able to do a lot of preventive care rather than waiting for people to get hypertension, the hypertension results now to kidney failure, and then we are, as a government, buying equipment that are very expensive to cure. And currently, the health sector, we are really focused on curative instead of preventive. And of course, even that, after that, there's rehabilitation. We have a lot of drugs out there in the market. We have also discussed on how we can be able to control the importation that is coming in. It's unfortunate that we have a board that has allowed some of the drugs to come in Kenya that are not even in the local language. We find drugs in Turkish, in Chinese, in a language that even the people who are dispensing the drugs cannot be able to read. And we're asking ourselves, when did the range start beating us? We know drugs are very expensive, or medicines are expensive in Kenya. Who controls the pricing? Are the multinationals controlling the prices of in Kenyan medicine? So when we are talking about universal health coverage, we're looking at accessibility, affordability. There are many homesteads that become poor when one of their own has become sick. And so for us today was to look at how we are able to work together. I've also emphasized on the health sector working as a team. There are people who feel they're the backbone in the health sector, others that feel they are the heartbeat of the health sector. But when you have, even if you have a very healthy heart and your toe is hurting, your body cannot function well. When you have a very strong backbone and your heart is not functional, then it can't work. So I've also encouraged them to stop the sibling rivalry that we have seen within the sector, and the sector must come together. And now that we have a new committee that was inaugurated in early February this year, which I chair, with committed members. We are uniting over. Some of them were in this profession before, and so we have an open door policy, and we are telling them that they need to come bring their issues, and we also escalate it to the government level. So UHC, when we talk about achieving UHC, it's not just about getting an NHIF card. We need, when Kenyans have the NHIF card, when you go to your dispensary, you'll get a doctor or a clinic officer, you'll get a nurse, you'll get even medications. So we'll be having several, even a health summit with the governors, with senators and the National Assembly, so that we now stop fighting on controlling of resources, but we start competing on giving the best services to Kenyans. And for sure, health sector will change.
Thank you so much, Mheshimiwa. Maybe we could have Mr. Patrick Adera. You're coming from the pharmaceutical industry, and there has been this issue about rogue and unqualified pharmacists. What are you doing as an association?
Yeah, just to put it right, this meeting is by Kenya Pharmaceutical Association and not PSK, not Pharmaceutical Society of Kenya. It is Kenya Pharmaceutical Association, an umbrella of pharmaceutical technologists. So back to your question, is that as an association, we enhance professionalism, we enhance ethical practice, and it is one of our areas of strength that to ensure that every facility that has medicines have professionals. And from what the chair has said is that we've agreed that going forward we need to engage the county governments to make sure that at all levels of healthcare we have the right people handling medications, because to us medications is like an armory. If you open an armory and let every person access an armory, then there is possibility that people will start shooting each other. And therefore drugs, despite being of benefit, they are also poisons. And the only experts in poisons are pharmaceutical technologists and pharmacists. And therefore we want the government to ensure that we have more pharmaceutical technologists employed, because out of 10,000 members that we currently have, only 400 are employed by the government, meaning that we have a bigger percentage that is out there. And we cannot talk about UHC without talking about having the right people do the right job. Let nurses concentrate on what they do best and have the pharmaceutical technologists do what they do best. That will ensure that the public is given quality service, accessible at the point of need, and given by the right personnel.
Thank you so much. I would like to have Madam Dorcas. Maybe for your part, there's this deadly syrup that has been ongoing for a while now, and also trying to make some of the youth so that it is used by the youth to make some drugs. And it has been an issue basically down here at the coast. Many of the residents are complaining that the deadly syrup, how is it going to be controlled in making sure that that doesn't happen at the local level in terms of our chemistry that we have?
The term deadly syrup is not correct. I think what we are talking about is codeine syrup. Yes, it contains codeine, which is addictive. But where we are now, we've agreed with the regulator to work together as professionals to control the movement of codeine to those youths. As we've known, there has been people who are doing merely business. But we have taken a promise. We are going to control from distribution down to retail. It is us, and down to rehabilitating those children. That is the best we can do. As long as drugs doesn't enter into the hands of non-professionals, which had happened. That is why now the youths are being already addicted. But we sat down with the regulator and agreed together to work as professionals in the supply chain of the drugs to control the movement of codeine. That one, we even produce an advert. I think you saw we signed PSK, KPA, and Pharmacy and Poisons Board.
But at some point, Kenyans are arguing that you can go to a chemist and also obtain the codeine.
Yes, we've started a journey. Yes, it was happening. That's why but now we've started a journey of controlling. Unfortunately, it cannot be one day's job or 1 month. It will be about a year or so. You will see the results.
Maybe lastly, your short brief with regard to this conference.
Yeah, the conference is good, and we have agreed as professionals that we shall help the government to control these illicit drugs. And also in this conference, the professionals has committed themselves that they will adhere to all the regulations which are in place. So as practitioners, we have agreed on that, and we hope also the regulator will also accord all these professionals proper licensing and proper regulation.
Thank you so much for your time. Well, there you have it, Ashley, in terms of health matters and what has been able to be discussed here in this two-day conference that has been ongoing here. This has been happening for the second day, and as you have heard from the chair for the Parliamentary Committee on Health, that are going to make sure that some of the deliberations that have been made here are implemented to the local level. Ashley.
All right, many thanks, Francis Mtalaki there from Mombasa. During the 38th Annual Pharmaceutical Society of Kenya Symposium,